Anxiety syndromes in Chinese medicine. Anxiety can be defined as a subjective state of unpleasant, restless tension and apprehension, in which it is difficult to relax or to find calmness and peace. Anxiety may have no apparent cause or it may be related to a specific ongoing situation or past event. When there is no apparent cause, the fears may be vague and formless, and they may be clear and vivid, although imaginary. Sometimes anxiety with apparently unknown cause relates to a past event which the person does not wish to face or remember. For example, sexual abuse. Anxiety can occur with post-concussion syndrome. It can follow withdrawal from drugs or medicines. It may occur with hallucinogenic drugs such as LSD. It may involve apprehension about a specific event such as an examination or an operation, and it is certainly aggravated by tiredness and general stress. Anxiety may arise in daily life when a person has to perform difficult tasks at high speed in an atmosphere of conflict and uncertainty. A person may become anxious when there is great pressure to make a decision. Their future rests on that decision, but it is far from clear what decision to make. Some people are more prone to anxiety than others, and the different five element types will manifest anxiety in different ways. Anxiety and the five emotions. Biological importance of fear and anxiety. Fear and anxiety have survival value to an animal under threat. The response to these emotions increase in alertness, respiration rate, heart rate, and muscle tone prepare the animal for flight or fight response. In humans, anxiety can be a healthy response which enables people to avoid danger or unsuitable situations or to achieve high levels of performance. However, if the state of anxiety becomes chronic or out of proportion to the stimulus, this healthy response can become pathological. Over alertness may progress to mental strain, insomnia, and exhaustion. Raised breathing rate to dyspnea or panic attack. Raised heart rate to palpitations, and increased muscle tone to muscular tensions, pain, or tremors. Anxiety and the heart system. In Chinese medicine, anxiety is linked with the heart and kidney system. It may be associated with other heart emotions such as agitation, panic, and hysteria. But anxiety differs from mania, in that anxiety is unpleasant, with mania may be associated with feelings of well-being and euphoria. Anxiety may occur with other heart signs such as insomnia, palpitations, hypertension, cardiac pain, pallor, and cold extremities. Anxiety and the kidney system. Heart anxiety is rooted in kidney fear with marked feelings of apprehension, the fear that something terrible is going to happen. Anxiety may then be combined with jumpiness and fearfulness, and with physical signs such as trembling, urinary frequency, or loose bowels. Fear, anger, and anxiety. Fear may give rise to both anxiety and anger, involving the kidney, heart, and liver systems. These three emotions may each cause mental, emotional, and physical tension so that the person feels and looks strained and tense. If there is liver gallbladder involvement, there may be additional feelings of uncertainty, indecision, irritability, itchiness, and hypersensitivity. And there may be headaches and pain, stiffness or tremors in the muscles of face, neck, shoulders, back, and legs. Fear, anxiety, and worry. In addition to the fearful apprehension associated with the kidney system, anxiety may also be linked to worry for the present and the future, and anticipation of problems which may never occur. In severe cases, the sense of insecurity may become very great and the person may become lost in an inner world of fears, worries, and obsessional thoughts, which may bear little relation to actual events in the outer world. Fear, anxiety, and grief. The lung system may be involved with kidney and heart in situations where there is a great insecurity and fear of loss. For example, a parent's fear that a sick child may die, or a wife's fear that her husband may leave her for another woman. Types of anxiety. In terms of Chinese medicine, anxiety is one manifestation of disturbance of heart spirit. This disturbance, this irregularity of movement may derive from excess, deficiency, or stagnation. Number 1, excess. The main form of excess that gives rise to irregularity is fire. Heart fire makes the spirit more intensely and irregularly active, resulting in anxiety or manic behavior. Heart fire and the liver fire and stomach fire that are often associated with it can come from suppression of emotions or from an overly rushed, stressed and hectic lifestyle. Heart flame fire is a form of excess that may lead to anxiety and confused thinking, speech and behavior. It is essentially phlegm from spleen deficiency and stagnation combining with heart fire. It can arise from emotional stress or excessive tobacco, alcohol and greasy foods with lack of exercise. Number 2, stagnation. Stagnation may give rise to disturbance of movement. For example, stagnation of heart and liver energy from emotional stagnation may lead to disturbance of heart spirit and to hyperactive liver yang, leading to anxiety. Stagnation of qi may result in accumulation of phlegm, which may disturb the free circulation of spirit, causing anxiety. Third is deficiency. Anxiety increases when the energy is low, when there is deficiency from lack of sleep and rest, overwork, stress, illness, malnutrition, and so on. Deficiency of heart and kidney energy, of heart and kidney yin, and of heart and spleen blood may each give rise to anxiety, since energy, yin, and blood are needed to keep the spirit stable. Anxiety and depression. While deficiency can be associated with depression and slower movement of spirit, it can also be associated with anxiety and increased irregular movement of spirit. Due to reduced control of spirit by energy, blood and yin, the principle of treatment is to calm and tonify. Similarly, while stagnation can be associated with depression and retardation of the movement of the spirit, it can also be associated with anxiety when stagnation and blockage disturb the regular movement of energy. Anxiety and depression differ in that depression is not usually associated with excess fire. Manic depression and depression with aggression are alternations between depression and a more active state. In anxiety, due to excess fire, the heat causes increased, fast and more irregular movement of the spirit. The principle of treatment is to calm and to disperse excess fire. I hope you gain knowledge from my video. Please subscribe to my channel and like and share this video. Thank you very much. See you next time. Bye.